Thank you, appreciate it. Hi everyone, how are you doing today? I'm glad we could finally make this happen. I think we figured out that it couldn't come out, so that's fine. So what I thought I'd do today is just show you a couple of projects that I've worked on over the years to give you a sense of the different ways in which I think of design and design thinking, and also what are the broader impacts that it can have. Is it still? I can hold it. I can do that. I'll try not to be so handsy then. So my training and my background, as the bio said, is actually as an architect. And a lot of my formative training focused on this idea of how to build a better building, how to make it more beautiful, more sustainable, etc. And that always felt a little bit hollow to me. It's important, but also I often describe myself as the weird child in my family who drew. I'm the daughter of social scientists. My dad was an anthropologist, and my mom actually is a public health expert. So I grew up with conversations about people around the table, and so when I got to architecture school, finding that that wasn't similarly part of the conversations was really weird to me. And so especially when you start to broaden out about thinking that it's rarely ever just about the building. If we're really starting to talk about how do we make better communities, all of this is actually part of the design project. And so a lot of my career has been really focused on how do we expand that understanding of what we need to design in order to reach a better outcome, not just an output, meaning the building. And then similarly, I think while operating at that level of the system, not actually forgetting that people are at the center of it. And so really looking at this idea of human-centered design, whether you're talking human-centered design for a small product or a program or even up to the scale of a neighborhood or a city, how do we always start with people and use that as both not only the inspiration but part of the process development, and how do we ensure that the outcome that we come up at the end is working across the system but at the end of the day is working for the individuals at the heart of that system. And so the projects that I'll show kind of speak to all of that. But one thing that I want to also do as a counterpoint to that, or not a counterpoint, but I should say maybe a companion to that idea, is I think sometimes when I know particularly in community engaged design, we've sort of struggled with this problem of when you start to talk about doing something for the people, there's sometimes a tendency that you're turning everything over. Like, all right, we give the community a piece of paper to draw on and say this is what you want to see. And really what I'm advocating for is that when you talk about creating human-centered systems, human-centered programs, human-centered buildings, it's really about trying to figure out a way of design where we're really building off of a notion of mutual expertise. So this is from a great book called Spatial Agency, and it talks about this idea of the expert citizen and the citizen expert. The expert citizen is many of us in this room, and it's saying that we've been trained with some sort of expertise. And I think oftentimes there's a tendency to think of expertise as it must be objective, it must be scientific, but the reality is that we are all human beings and we are never ever purely objective, no matter how hard we try to be. And so I think this pairing of citizen with that asks us to remember our own humanity, and how do we bring that to the table? That is a combination of both our humanity and our expertise that makes us as good as we are. And likewise, the people in many of the communities that I'm engaging with are the citizen experts. I will, no matter how long I spend studying a community, being embedded in a community, I will never know as much about that community as the people who live and work there. But rarely do they ever get co-powered to think of that, or empowered to think of that expertise, that knowledge as expertise. So some of the work that I do is that how do we build space at the table for that acknowledgement, recognition, and co-powering to happen, and how do what we create at the end of the day becomes a combination of both of those forms of expertise. So I'm really fortunate that I get to do projects all over the world. And for me, part of the benefit of that is that it actually helps kind of blow my mind on a regular basis, in the sense that, you know, I could be working on a project in Nairobi at the same time that I'm working on a project in Dhaka, and they may have two completely different clients and ideas of where they're going, but there could be similarities in terms of the basic human reactions that makes me think of one project differently. So for instance, actually the project I'm going to talk to you about today, Jacaranda, I was working on that, and then I went to go and work on a project with the Global Alliance for Improved Nutrition in Bangladesh that was supposed to be about nutrition systems. The Jacaranda project's about maternal health, but there was something that had to do with how mothers are thinking about the best health for their child that was coming up within the Jacaranda project that actually had implications for the Bangladesh project and made me think about it in a way that I wouldn't have if I hadn't been doing that project in Nairobi. So for me, it's all about cross-pollination that I'm able to bring to different projects. So like I said, I'll show one example from the Global South, which is the Jacaranda example, and then I'll also show a project that I just completed here in Virginia. So the Nairobi project, Jacaranda Maternity, is this pretty amazing maternal health social enterprise. And basically, they've come in with a pretty daunting challenge. Within East Africa in general, there's actually high rates of maternal mortality. And this idea of what to do with that is something that a lot of different aid agencies and organizations are looking at. Jacaranda took the model of how can we set up clinics that completely revamp the way in which the maternal health process happens within Kenya. And so they started off within Nairobi. And I and a partner were informally advising them for the first year or so with particular respect to the clinic design. And about a year or two into the clinic being operational, they came back to us and said, we've really tried to take this approach that is human-centered within our clinics and in how we talk about the nurses relating to the patients. But we're seeing that while we are getting people in the door initially, we're not seeing them actually maintain their prenatal care, and then we're actually seeing a giant drop-off when it comes to delivery. And the whole model and the whole idea of actually being able to revamp maternal care really rested on this idea that somebody would continue with the prenatal care and in particular deliver here as opposed to going to the public hospital. And so they wanted to understand why, and they had reams of data, spreadsheets, and quantitative analysis that was supposed to point to why wasn't it working, and they were still finding that they couldn't unlock it. So they said, can you guys just come? We think actually maybe it has something to do with the building, that the building's just not functional and working and turning people off. But we were really interested in you using the human-centered design process to see if you can unlock what we could do to convert the building to get it to work better. And so they, I think they approach us knowing that we're architects and thinking that, okay, as architects, you can figure out how to make that building perform better so that people think of this as an inviting space. And there were some other issues that they thought were at work, such as the fact that, women would be getting the money from husbands to be able to go to the clinic, and so maybe it's also a challenge of us educating the husbands. We don't know. So we came in and we did do some work looking at the actual clinic spaces, and there were some challenges, but a lot of the human-centered design process really starts with this idea of problem definition. And so I always go in with the assumption that the problem that my client has sent me into the field with may not actually be the right problem to solve, and I would say 9 times out of 10 that does prove to be the case. And so a lot of the work actually spent in the beginning starts with identifying who are the end users or the people and talking to them so that we can start to position where the problem is, and also talking to the people at the clients, in this case the nurses who staff this clinic, in order to understand how we could figure out what it is that we needed to change. So I got to spend several weeks talking to mothers and very cute babies. And part of the process is also to sort of say that in order to actually talk to people and understand at a very real, authentic level what their lives are like and what the issues that they're contending with, you can't post in a hall somewhere or in a random meeting room in the clinic and tell people to come to you. You have to go to them. So our interviews would take place in their homes. And similarly, the interviews were not rooted around asking, okay, how can we make the clinic better, or what was bad about your experience? That was maybe a quarter of the interview. It was really this idea of understanding their entire life, what is their day-to-day like, because until you can position the issue within the context of your life, you can also position the solution in the context of their life. So and the more conversational we can make it, the more people would share different things about their lives. And so often we would find it's in the nuances of things that weren't even directly connected to an understanding of health and healthcare where the actual solution set that we needed to identify could come from. And thinking of it as a system, it was also really important to sort of say, okay, it's not about the problem being the patients not understanding where the value is here. Like, we have to look at the entire system. Even if the patient is at the center of the system, there's a whole ecosystem of actors that influence them as well. So we went into other clinics and hospitals in order to understand how things worked there. So this is actually the nurse manager at a pretty high-end hospital that most of our target population was sort of working class, poor, and below. And this is a place that really you would only go to if you were middle and upper income. But it was actually a helpful conversation for us to understand what are commonalities in the ways in which people make decisions around healthcare within the Kenyan context versus what are differences that start to come out when you start to factor in things such as class and affordability. We also talked to husbands because they were flagged as being part of the issue, and so we wanted to understand from their perspective what factors in when they think about these decisions and choices. And the great thing about having these conversations is it also allows us to poke at assumptions, right? So my clients are experts in health and public health, and so they had the data that was telling them this is what's happening, but the data was also rooted somewhat on some assumptions, right? So when we talked to husbands, what we found wasn't that they were saying, oh, you can't go to that clinic because it's too much money. Actually, a lot of the husbands sort of said, we abdicate having to be involved in this situation completely. That is women's business. Don't really understand what's going on. And so what was happening is they didn't abdicate that responsibility to their wife, they abdicated to their mothers. So the mother-in-laws were actually playing a huge role in decision-making around clinics. And that was not a group that had come up at all in any of our conversations with our client, and nor had it come up in some of the programs that they were starting to pull out. Yet they were key to the decision-making of what clinic became the choice for delivery. And a lot of the mother-in-laws were going with what they knew, which was the public hospital, even though it had a terrible reputation. Babies had come out of their lives, so why wouldn't that be similarly good for their daughter-in-law? And so just being able to tease out some of these things, again, this wasn't the entire issue, but it was one thing that hadn't been flagged by anyone before that we were able to get out of these conversations. We also went to shadow the nurses. So the idea of looking at a human-centered process isn't just rooted on interviews, but it's also looking for different tools that allow you to understand what happens in context. And so in this case, they had actually just been running a pilot program of having this one nurse who would go around and make postpartum in-home visits. And so we followed her, and mostly we were literally a fly on the wall, just observing the visit, observing the interaction, the questions that were asked, and occasionally asking questions ourselves. And what we found from this actually became one of the crux of our solution set. So part of the way in which this clinic works is not that you get assigned a nurse. It's this idea that the nurses are all kind of really trained, and whoever is there when you make your appointment is who you get to see on any given occasion. It's not that you have, like we do, an assigned obstetrician who would be working with you throughout the entire process. And so what we found is, because she's the only one who's doing this pilot program, the bond that was created with her and the trust, especially with first-time mothers who were freaked out that they had this little being that they were supposed to take care of, that they were not only asking her these questions within the visit, but they were calling her cell phone all the time, and that they actually deeply trusted her in a way that we weren't hearing trust being made with any of the other nurses on staff, who were similarly nice, similarly giving of their time. But because this relationship had not been bonded, that this is the one person you can always come to ask this particular question, it became a huge issue with people. Not that anyone would ever be able to express it, but it was actually something that popped up in terms of their loyalty and their belief of, oh, well, I can just go to any clinic because it's really just about the treatment. It's not about the relationship I'm building with the person. And then, part of this idea of how do you get immersive is not just about externally talking to other people, but also finding ways to be able to put myself in the shoes of the end user. So one of the things that was fascinating is when we interviewed a lot of the nurses, they would tell us the things that they said during the course of these setups. And we were like, well, it all sounds like the right thing. We're not quite understanding what the issue is. So finally one day, my partner and I said, okay, we're going to be a pregnant couple, and we're going to go through this experience. And I don't want you to just tell me what you normally say. Treat us like we're actually coming in and do everything from the intake to treatment. And it's amazing the list of stuff that we came up with that was actually problematic. You know, and it was everything from the fact that examination table that I showed you. So I'm a pretty tall person. It was actually really hard for me to get up on that examination table. So you can imagine a pregnant woman trying to get up on there. Or a little thing like, you know when your mom has told you to be nice to somebody, and that person can kind of tell that you're being forced to be nice to me? That was kind of the demeanor. It wasn't that it was bad intent, but it did feel like it was reading out of a script. And so I can understand why somebody wouldn't feel a bond of trust with that. Or she asked my partner, who was playing my husband, to take an HIV test, and then was super insistent when she was like, no, I don't want to do it. Now, you can imagine if there is a husband who's been stepping out on his wife, he may not want to take that test right there. And the more you insist, the more it sort of brings up, oh, there might actually be a problem here. But she couldn't pick up on that cue. And so finding these little things that were actually challenging within the process is, you know, at this point when we did this, we had already been in the field about 2 weeks. And the list of stuff that we had that came up out of this, none of that had come up in the course of 2 weeks, either from the nurses or from the former patients or current patients that we had talked to as part of the process. So out of the work that we did, we actually kind of came up with 5 areas that needed to be addressed. And you can see in there, there's nothing that specifically speaks to the idea of the building. The building is sort of embedded in some of these solution sets, but really these were the areas that we found that there were actually changes that could be made that could make a meaningful impact on what they were doing. And it's everything from customer care, which is like really what is the experience that a patient goes through, to also more specifically the birth experience and how to use that as a differentiator from the experience that was happening within the public hospitals. Even thinking about things like customer loyalty, which is something that sometimes it's from the business world, and there's a tendency to sometimes poo-poo that kind of stuff, but actually part of the challenge here is that there wasn't any loyalty. So the sense that medical records, the way they're done there is like you actually get a little book and you take that with you. So it's not like your medical record is actually kept at one clinic. And so that was part of what allowed people to feel like I could go to this clinic for this session and I could go there for birth or to do something else. And then also that the financial decisions played a role. There is a cost differential between this, even though it's a social enterprise, and the public hospital. And then family involvement, and what we wanted to do is also remove it from the male involvement, which is how they were thinking about it, to family involvement of like, who are all the people in the family who affect the decisions that are being made around where do you go for maternal health care. So just some examples, and really a lot of the work around the human-centered design process is you can take an issue, but you can also humanize it in a way that gives it a specificity of context that makes it easier to both describe the problem and talk about a potential solution. So we, of course, use the example of Carol, the nurse, who does the postpartum visits. And then we framed the question of how we could get to a solution, looking at what was working there, and then trying to say, how do we amplify that? And so because this was just an initial strategy project, the things that we would just come up with a bunch of different ideas that needed to be tested out that could potentially build on the opportunity areas that that question suggests. So in this case, we actually said, why not consider switching from a model where you see anyone to where you actually get one dedicated provider? And knowing that some of these might actually take a long time for them to be able to implement, one of the things I do in a lot of my projects is this idea of quick wins or low-hanging fruit. What are ways that you can begin to test things connected to the idea that enable you to see whether or not it could really work or what would actually be required to build this as a more formalized system? One thing that came up that actually hadn't been flagged by a client before was that transportation was actually a huge issue at the point of delivery. So they didn't really have any ambulances, and if you've ever been to Nairobi, the traffic is atrocious. And so if you are in labor, there was a huge issue of women thinking, if I have to sit in traffic and I can't birth my baby right away, that's actually going to be bad for the baby's health. I just need to go to wherever I can get to soonest. And that was actually influencing a lot of decision making in a way that the client hadn't anticipated. And so we started talking about how could you think about creating a dedicated transportation service. You wouldn't necessarily escape all the sort of challenges of the traffic, but it would add in an air of reliability that the women would actually value. And so, of course, starting a transportation system from scratch is crazy. So, you know, for this one, we said a low-hanging fruit is why not contract with a couple of taxi drivers that you just sort of say are always on call. You give the taxi drivers a bit of a cut to be able to do this, and provide that reassurance and see whether or not that is something that actually does build a little bit more loyalty at the delivery process. So they started piloting some of these things, and actually they're working now with the School of Public Health at Harvard around not necessarily all of these solutions, but some ideas that are connected to how do we help create more empowerment around patient choice and more education, building off of some of the things that we identified are reasons why people are making the choice not to always remain loyal to this place. And for me, I think this is a quote that a former colleague of mine said, and I think what we brought to this situation is, you know, like I said, they had reams of spreadsheets from all the different surveys that they had done, and I think there's sometimes an over-reliance on quant as being the only data set that we can work with. And so in this case, what we tried to say is, like, let's also bring these stories, which have an incredible amount of nuance and data with them, to the table as not being better than the quant, but working in partnership with the quant. And a lot of my projects, I can show you the cute pictures of kids, but I also have like data sets that come out of that where I can say X percentage want this, X percentage believe that, but the way in which I got through that is actually through these stories that help mark out people's lives in a greater way. And so on that point, what I wanted to do next is show you a video from a project I did a couple of years ago, actually, when I was with IDEO.org. I'm not going to go through the entire project, but I think it's a really great illustration of this idea of stories being data with a soul. So just a little background about it. It's a project dealing with cook stoves. Those little sort of almost campfire-like stoves. So there's a huge push to increase adoption in the global south. And back in when did we do this project? 2012, the Global Alliance for Clean Cook Stoves, which is a UN initiative, approached IDEO.org because they were concerned. They felt that there had been a lot of advancement in cook stove technology and getting it into different markets, but they weren't seeing a similar adoption in the use of the stove. And so they were concerned because there was a huge push to get governments from around the world to invest in it. And if they couldn't improve the numbers, it seemed really problematic. And they felt there was a tremendous benefit that could come from cook stove technology, everything from not having the better health impacts of not cooking over a wood fire to decreasing deforestation, et cetera. So they sent us into one of the target regions, which was East Africa, and we spent 3 weeks in Tanzania talking to over 40 different end users. We also talked to nonprofits involved in getting the stove to market and to cook stove manufacturers. And what we found, which the video will show, is that the problem needed to be redefined. It wasn't about how to get people to adopt the stove. So similarly, the Global Alliance had a lot of data about what they thought were the issues, and there was actually a huge separation between that data and understanding some of the nuances in people's lives. So the text from the that backs that is all composite from what we heard in the conversations that we had with people in the field. And part of the reason why we made the video is that we realized in comparing what we had been told prior to going into the field to what we saw in the field, that there was a real gap in understanding what the day-to-day realities were, and bringing that would enable people to be able to make decisions that had a little bit more sort of human-centered context to it. So the last project I'm going to go through quickly is actually a US-based project that I just wrapped up the master plan on. And even though it's more building related than the two previous ones that I showed, you'll see there's still the same type of inquiry and the same type of expanding beyond beyond just looking at it as strictly a building project. So Friendship Court is located in Charlottesville, Virginia. It's about 40 years old and has never had a significant redevelopment in its time. It has about 500 residents, more than 50% of them are kids. Over 90% are single female-headed households. It's all Section 8 units. It's over 80% African American, and the median income in Charlottesville, which is sort of the home of UVA and so has a very high professorial class, is $10,800. And so it is now coming up for redevelopment, and in all likelihood will be redeveloped as a mixed income property because of the way in which housing finance works today, which I will not bore you in. The main way that a lot of these projects are getting financed today is by turning them from all low income to a mixed income property. And so we were asked as to how to create a master plan that had a real resident informed process, because they were guaranteeing that all 150 households had the right to remain, and actually there was a whole zero displacement thing on it, so even during construction we would not be able to displace anyone. So really figuring out how to create this as a more holistic thing became the centerpiece of the master plan. So as you can see, I'm fond of going into people's homes. So in this case we did the same thing. We didn't start off with community meetings of what would you like to see here, went into people's homes to really understand how they lived and also get the answer to just to that question, to be able to understand what did this place need to be to not only provide better shelter but actually radically improve their lives. Because of the fact that there were so many kids here, and this happens actually in a number of my projects, it's also looking for ways to engage the kids. So we actually did a series of youth and teen workshops every time that we came, and this was a group of kids who were not used to being asked what they wanted to see or what their lives were like. And actually the ongoing part of this project is that with UVA's support, we were able to get a foundational grant to launch a youth leadership program, so the youth are being trained to be cohorts in this process throughout the very long multi-year redevelopment. So again, the idea is not always just pulling stories that are really cute and tug at your heartstrings, but how do you translate that into data that has an impact on the process? So in this case, one of the things that we did is that we took all the stories from what we heard and used it to begin to map out the site. So not just approach the site as, say, I'm an architect, so I can tell you what pieces of the property aren't working and the fact that the green space gets flooded. It's more actually looking at how this is actually work now. So one of the things that came up is that there was a fence that was erected in the late 90s for security reasons. But what we heard from a lot of people is that basically that fence makes this place seem like a prison and reinforces the idea that this is a ghetto. So starting to illustrate the site through human terms to talk about the things that needed to change. This ended up resulting in the fact that actually part of the master plan solution is to bring the streets through and actually create a neighborhood feel and break it up so that it feels reintegrated and not isolated from the neighborhood. This is what the exterior looks like in the interior of the property. There is actually no great outdoor space. You often find people sitting on the fences, which is actually not allowed by the lease rules. They're also, up until recently, were not allowed to actually sit on their porches. And so as a result, there was a good significant proportion of adults who actually were home during the day, either because they were underemployed or retired or suffering from disability, and there was no place for them to go outside. The majority of the outside spaces in which you were allowed to hang out were courtyards that were generally geared to kids who were like 7 and under. And so what we found was a lot of adults who were hanging out on the inside and feeling quite isolated, that they didn't really know their neighborhoods. The inside looks like this. So this is like 10 a.m. in the morning. And a lot of the units were really this dark. And so it was both a combination of you couldn't hang outside, you're feeling isolated, and then you're also locked inside into this place that feels even more depressing. And so what we found is that that also carried into how people talked about the place and how they talked about not wanting to remain, but feeling stuck because there really weren't any options. And so illustrating this and looking at it as part of the tool of how do we think what we're doing is not just like, oh, let me give you a new coat of paint and a new apartment, but like actually radically changing the experience here, because it actually had huge implications not only to mental health but also to physical health. And so, like I said, we essentially used some of the stuff we got not only to understand the physical space, but also to understand the kind of social and economic space that we needed to revamp. So Tammy's statement was something I heard consistently, that a lot of people thought this place was better than public housing, but they actually didn't expect this was where they were going to end up. It was just where they were going to land on their feet for a little bit, and they would hopefully be able to move up and out somewhere else. But because they were living on Section 8, if they happened to get a job where they could earn more income, their rents would go up, or they might have more costs with daycare, or their transportation costs would go up. And so basically they just felt stuck. And so that really impacted the way in which they thought about this place, and there was actually a huge amount of sadness of feeling like they were stuck. And so they were excited about the idea of it becoming mixed income because they felt, oh, well, this place will now get better. And because there are things that don't come to me because I'm poor right now, people would come if there were middle income people living here. And so what we realized is that the funny thing is, if it was just Section 8 and market rate, like actually that does not allow any ability to move up. The difference between a Section 8 rent and a market rate rent is huge. And so we realized that part of creating this so that this place would feel like a place that you are upwardly mobile had to be thinking about how to fill in that gap through a variety of things. So some of that was programming in terms of starting to look at who do we need to partner with, people who do job training and access, but part of it was like fundamentally looking at how we frame this development. And so we actually realized that we couldn't just have market rate and Section 8, that we actually had to fill in the middle so that people could actually feel like they could move up in place. And the thing about being able to bring that understanding this early in the process is that we were actually able to start to look at how to make the financials work. So it wasn't just this idealistic thing handed off, say, great. But we actually were able to seed things into the programming of like economically it had to look like this, and programmatically we had to look at partners that would help support this. And then with this process, it was also not only helping us understand how to lay the sort of foundational background of what this thing needed to look like, but then also to start to talk about how to make this a place of opportunity and a place of desire. I think sometimes when working with low-income populations, there's a tendency to focus on need. And need is great, and addressing it is really awesome and what we should be doing, but solving need doesn't always address things that relate to behavior change. And I think that plugging into desire is equally important, and desire is something that has an emotional quotient. So a lot of the work they do is I can say that providing an ability to move up economically maybe addresses a need because it really isn't anything besides public housing and our property within the town of Charlottesville. But plugging into the desire is what will make people actually want to support this project. And so it's shifting a lot. What the human-centered process here has allowed us to do is really shift what are the inputs, rather than saying as a building project we're looking at the size, how many people need to be accommodated, how many 2-bedroom apartments we have versus 4-bedroom. we're looking at this whole spectrum of stuff as being what we need to address to this. And then likewise, we're not just focusing on the output of the building, but really the outcomes of where we're trying to get at. And it allows us to also figure out who do we need to bring at the table. So what's been interesting with this project is that in this early stage, we were actually working with folks at the School of Nursing, the School of Education, the School of Public Policy, as helping us figure out how to seed all of that stuff in this project so we could really reach these more holistic outcomes. And so I think for me, this quote sort of leave you with this idea that actually part of this process has allowed us that when people are used to not being heard, and so through this process they've started to feel like they've heard and they've become more engaged in the things that we're trying to do. And I think that that will make them more effective advocates in the process overall, rather than feeling like this is something that is done to them. We really wanted to create an environment where it feels like they actually have a way to make a voice in this. And really, I think there's an element of this that's like about how do we get more specific. I think sometimes when we're dealing with big specific things, it's easy to operate at this level. And the key with the human-centered design process is like, we can operate there because we have to think of the system, but how do we also operate at this level too? And just very quickly, I mean, so I do a lot of work around race and community development as well, and I show this often in my lectures because I think that the thing of this moment that we're in now is not just because, you know, this is not the first time that black men and women have been unjustly killed, but we know their names, and as a result of that, we know a little bit of their life experience, and it causes us to look at these problems differently, I believe, and also sort of creates an urgency in a way that I think has been lacking in some ways. And so a lot of the work that I do here is also how do we start to talk about these people with their specific names, their specific life experience, and how does that become part of the real data and the real considerations when we start to do this project. And so that we can talk about Eunice and we can talk about Tammy, and that their stories are actually what we're thinking about when we're trying to think about how to make change. And so the very last quote I'll leave you with is one that was by Brian Stevenson, who talks about this idea of getting proximate, and that we can understand, you know, he deals a lot with the incarceration issue, but this understanding that we also need to figure out how to get proximate, because that allows us to hear nuances and details that we can't see when we're operating from that distance. So with that, thank you. Yeah, so when I teach my students, the dumb cheat sheet I do for the interviews is that it's usually divided into thirds. So the first third is really the kind of get to know you piece. So I kind of say it's akin to like if you were meeting somebody for the first time and trying to like, what are the basic questions you would ask to understand about somebody's life? And then the last third, I'll jump to that for a second, is the questions that actually pertain to whatever is the issue or problem you're supposed to be solving for. So the middle third is essentially the bridge. How do you start to get deeper questions that build around that? So say with the Jacaranda project, the middle third had everything from, you know, what do you do for a living and how much money are you making on a daily basis, and what are you guys spending money on from month to month, to how do you keep healthy, or what do you do when your child is sick, to like start to frame like what is the money situation, how do they think about health in general, before we get to the ones that ask specifically about how do you make decisions when it comes to maternal health, or even like how do you make decisions in general. Like we ask about brand loyalty in general to understand what keeps people loyal to things, and then you know, the last time you had to make a big purchase, how did you make a decision? How did you figure out what to do around that? And all of that gives us cues that seem really different than what we're looking at, but are actually completely related, because that same decision-making process actually factors in to the decisions that they might make around clinics. We'll just go up that way. If you guys want to chime in, you can as well. Yeah, sure. I was actually telling some folks about that this morning. So one project that I'm working on is in San Francisco, and it's the redevelopment of an old power plant into a community hub that will sort of hold the space for the 5 to 10 years before long-term redevelopment happens. And so the client is still the utility company that owned the power plant site, and they're like, we do energy. That's what we know. We're not community developers. So everything is an uphill battle with them. And what it meant is that we had to break things down into sort of bite-sized pieces. So I refused to hold community meetings because I had been to community meetings for other projects in this neighborhood when I worked for previous forums, and there always were like disasters. And so I actually said, we're just going to do interviews with people who were involved in the closure of the plant to start to say, what were you hoping to see here? And we made one member of the client team come with us. So then when we proposed the first stage solution, which was radically different than anything that would have been there, she was able to say, oh yeah, that did respond to some things that we heard. Or we started, our community meetings are basically events, everything from like a job training workshop to a circus. And there are always things that could fail, right? But because they're so small, we're just like, oh, we're just going to do this one little thing. They let us do it, and then we document the heck out of it. So like, and capture both what people are saying and what they did. And like, I've got tons of reports that I've written off of it, so it gets mutually reinforced. But it's also like I've learned what the language is of the client that they need to understand it. So they're not in it to be good community stewards, although that's part of it as well. But for them, it's a site management strategy. So basically, when I talk to the higher ups who are like, what the heck are you guys doing? It's like, well, you could spend money maintaining a fence and a security company to keep this 30-acre concrete site vacant for 5 to 10 years and getting complaints from the mayor, who was hearing it from community members who are like, why is nothing happening on the site? Or we could have programming now that starts building community stewardship of this site, and that they come and support you now in meetings, which is not something that people typically associate with this company. Which one is of value? It's a site management strategy. And so when we say it like that, they're like, oh. So I think a lot of times it's also like I'm getting the thing I need from my client, but I'm also taking the time to learn their language so that like I'm not trying to force them to understand this community social benefit thing, although it kind of is, but I'm retranslating it in a way that they understand within their business model.